News, because local matters.
Let's talk a little bit about the community we live in and the efforts made by so many people to improve the lives of our neighbors. That is definitely true of Volunteers in Medicine, which celebrates, is it 20 years this year?
It's coming up.
This is Joel Henderson, who's always very proud to come here representing Volunteers in Medicine. But he actually was invited this morning to come on with Dr. Marshall Horton, who is a retired gastroenterologist, but in no way have you retired from your effort to help people. So you're very proud of a grant that y'all have recently received, right?
Yes.
Specifically towards colon cancer screening, is that right?
Yes. I'm with the Greater Chattanooga Colon Cancer Foundation, and our mission is to increase awareness of colon cancer and to spread the word and educate people of the benefits of colon cancer screening, whether it be with colonoscopy or stool testing. In Hamilton County, if you look at people over the age of 50, about 2/3 have had colonoscopy. Though if you look at the uninsured, it's only about 20%. So yes, we did recently receive a grant to focus on those without health care insurance, and we partnered with Volunteers in Medicine and Project Access, and I'll let him talk about Volunteers in Medicine. But Project Access is a program of the local medical society in which local physicians and hospitals donate care to those without health care insurance who financially qualify free of charge. And we're initiating a marketing campaign trying to make people aware of this opportunity.
So Joel, kind of to simplify all that, what that means is if you are currently without health insurance, maybe you work a couple of part-time jobs and health insurance is not offered to you, and even though you could theoretically buy it on the marketplace, it can sometimes be cost prohibitive for people. Is that what you find?
Very much so.
So y'all are there to kind of be the gap, the bridge gap for them.
And I love that, Julie, because it is a bridge gap. I mean, so we're primary care, and as Dr. Horton was mentioning about how we partner with Project Access, I call them sometimes our cousin, for specialty care. So if a patient comes to us, they're very sick. It might have been 10 or plus years the last time they saw a physician. And at that time, some of our providers say, where do they start? Well, the nice thing was that prevention piece that we're talking about colon, is think about that. I think about that even for myself, if you don't mind me sharing.
Sure.
It's personal. I recently lost my mother, and if she'd had colon regular testing and screenings, as a small business owner, sometimes I don't think about those type of things, lack of insurance. Hopefully she would still be here with us today. So it's very personal. Besides my patients, which they come in, I'm a big hugger. That becomes personal for the community that we serve. And I share that because when they come in, we say, besides being here today to get that care, we also offer an opportunity to have prayer with our patients. So it's a nice holistic environment of getting, as we call it, a medical home.
Right. So of all of this, I think there are a large number of people who just don't make going to the doctor a priority. My husband is one who does. I am one who doesn't. I will give you that as my little thing. But I think sometimes of all the cancer screenings that are out there, this is the one that most of us try to avoid. So if you don't want to go through a colonoscopy, is that a no-no? Because there are other ways to do it now.
There are other options. There's stool testing. Typically, or oftentimes, colon cancers and large polyps result in loss of small amounts of blood, and we can chemically test that. The optimal test that we use at Volunteers in Medicine is the FIT test, fecal immunochemical test. There's also a more expensive test called Cologuard, and I'm sure we've all seen that advertised, which combines the FIT test with an analysis of DNA, looking for abnormalities that can be associated with colon.
If caught early, highly curable?
Yes. And the optimal condition is to have a colonoscopy, remove polyps, and thus remove the potentially precancerous lesion and reduce the risk of colon cancer in the future.
Does it tend to be a genetic issue?
There is an increased risk if you have a family history. That increases your risk substantially and may warrant having a colonoscopy even earlier than the age of 45, which is the current recommendation to start screening. Previously it was 50, but because of an increasing incidence in younger people with colon cancer, the age was lowered a couple of years ago to 45. But if there's a family history, it may warrant starting even sooner.
Does diet play into it heavily?
It's one of the risk factors. Diet high in red meat and animal fats associated with an increased risk. So it's important to eat your fruits and vegetables.
Okay. So for people who are heavy on the protein, if you're getting that protein from animal, you better be careful.
Yeah,
Is that right?
can increase your risk.
It
And
can.
it's been estimated that lifestyle issues, which there are several, are responsible for about half the risk of colon cancer. So people should avoid smoking. If they drink alcohol, they should do so in moderation, maintain optimal body weight, and get out and exercise.
And if they want to take action today by reaching out to you with this grant now that's in place, do they go through Volunteers in Medicine to do that?
They can go through Volunteers in Medicine, or they can check out our website, gcccf.org, and we've got instructions there of contact information.
So once you find out if you qualify, then they'll work on getting you in to get an appointment. You'll get screened, and should they find something that requires treatment, they're going to walk with you through that as well so that you won't be alone. Do I have that right?
Absolutely. And if I can add,
Sure.
we are definitely accepting new patients.
Okay.
So it's as simple as calling us or going to our website as well, vim-chatt.org, and see some of the questions. We're located over by Eastgate Mall area, and we're trying to better serve. So you see on the back side, we're also a Hispanic community. So it's a growing need to continue to serve more, and that's what we're trying to do in our community.
Well, happy anniversary to you
Well, thank
almost. I'm
you.
sure y'all have a big celebration, and thanks for the work that you do. Really appreciate it.
Thank you.
Find your new home at Idle Place, Catoosa County's newest community. Unique 2, 3, and 4 bedroom designs, perfect if you're downsizing or a first-time home buyer. Quality cabinetry.